Get off social media. That could soon be a real order from the doctor's office. A new study found just 1 week away from Facebook, Twitter, Instagram, and other platforms showed a significant boost in well-being, plus drops in anxiety and depression. But as we know, it can be tough to stay away from your feed. Here to discuss the impact of social media on your mental health, Dr. Nicole Siegfried, Chief Clinical Officer at Lightfully Behavioral Health. Thanks for joining us this morning.
Good morning.
Well, are you surprised that it only took a week to see a difference in somebody's health once they stopped using social media?
Not at all. Actually, what we know is that the effects of social media can be immediate and long-lasting. And so it's not surprising that just taking a small break could make a big difference.
Why do you think that is? What is it about social media that is so stressful?
Well, mostly it's that the images that most people are accessing are unrealistic, and it creates a sense of what we call FOMO. Fear of missing out is one aspect of the negative effects. But then also, we also see people's highlight reel versus what's really going on backstage. And then finally, a lot of people experience bullying on social media sites where the feedback that they're getting is very negative and can really make an impact that is long-lasting beyond the image.
Most people not likely to stop using social media or cut back a lot. How can you lessen the impact that it has on mental health?
Well, what I liked about this study that just came out, the 1 week off of social media, actually the individuals in that study still had about 21 minutes per week on social media. And so they didn't technically take a break from social media. And so that's much more realistic than a complete break off of social media. And so what our recommendation is what we call harm reduction, which is lessening the impact of social media and not being on it quite as often. There are some positive impacts of social media that if you join the right sites or access the right sites, follow the right people, that can boost mental health. And so we wouldn't recommend a complete abstinence from social media. It's learning what sites can be helpful. The other thing that I recommend is what I call no phone zones, where...
Oh, doctor, I think your signal has frozen on us.
It's a technique that we call it.
Go ahead.
We use what we call stimulus control, where we decrease the number of areas or situations in which we're utilizing social media. And by doing this, that can reduce how often you're accessing those sites. I call it no phone zones. So if it's in bed or if it's at the table, at dinner, just by changing what situations the social media in, you can also decrease the number of hours you're using social media per day and per week.
Doctor, some great advice. I think everybody agrees it's changing how we live and not always in a good way. So maybe we need to look at new ways to regulate it. Thanks for joining us this morning. We appreciate it.